Talk about end-of-life care or serious debilitating illness, but it's critical to clear up any confusion about medical and legal decisions, and one of the tools to help with that is an advance directive. Joining us to talk about that is Bob Hamilton. He's the director of Cone Health's Department for Spiritual Care and Wholeness and a member of the Cone Health Ethics Committee. Good morning to you.
Good morning.
It is one of the most difficult things that conversation you can have as a family, but it's so vital because when it comes down to that time, you want to know what a person's wishes are, how they want their life to be handled correctly?
Absolutely.
Yeah.
And I think many families know what they want for themselves, but they may not know what the other person wants, and it's the other person they may have to make a decision for.
A lot of times if somebody is sick, they have a very, very serious illness, they can get into a situation where they're not able to communicate, or maybe they're kind of going in and out, and you want to know, and I think people are uncomfortable with it, but all of a sudden it gives you a sense of peace, knowing that what you're doing is following their wishes.
And I think you've nailed it. I think when that time comes, family are dealing with their own grief, and sometimes with their own guilt, whether they're doing the right thing.
Sure.
And so I think if they have a clear idea of what that person wants, especially what quality of life would matter to them, then I think it makes it easier, not easy, but easier for them to feel like they're doing the right thing for their family member.
This term advance directive, what does that mean?
So it sort of says it in its title. It's a directive in advance of a time when you may not be able to make a decision for yourself, but you're giving guidance to others about what decisions you would want, or you're appointing someone to make decisions for you. And so you do that in advance so that all those questions, all those things that you would want or wouldn't want are made clear to your family members.
Now, is this the same thing as, say, a medical, there's a power of attorney, there's a medical power of attorney? Does this fall in line with those? Is it the same thing or what?
Well, it's a healthcare power of attorney is one advance directive. A living will is another, and that's where you're sort of defining what conditions you would want to have your life prolonged or not prolonged. There's also an advance directive for mental health treatment, which helps people decide what treatments they would or would not want to receive if they're not able to speak for themselves.
Now, this is something that you don't have to develop on your own. There are pretty clear guidelines, and there are a lot of people who are willing to lay it out and explain. It's not something that you have to be confused about. It's not necessarily a check-off kind of box form, but it does allow you to individualize it to a degree, doesn't it?
It does. All these forms have wording that's in the state statutes, and so most of those that you find used in hospitals are following the state statutes.
Right.
But they do. A living will gives you some opportunity for decisions to make, and then an opportunity to fill in things that you would want. And healthcare power of attorney especially allows you to specify some things you would or would not want, so that that person you're identifying as your decision maker will know exactly what you want.
Well, thank you for talking about it today.
You're welcome.
If there's anything we can emphasize is that it's better to do it early than to wait until you can't do that. So it's
absolutely, and it's important for families to talk with each other about exactly what they want. So when that time comes, you've had that conversation. It's not a surprise at that end time.
Thank you so much. We appreciate that. By the way, if you want to find out more, Cone Health has a kind of a part of their website set up for this. You can get a lot of questions answered at conehealth.com/advance directive, or for other tools and resources that promote a healthy lifestyle, just go to conehealth.com/wellness-matters.
House Call on Fox 8 is sponsored by Cone Health.